Hi, my name's Michelle. I am the owner of Aesthetic Nerd and I am a national director at Les Encres. I am here to talk with Denise about everything in aesthetics. You want to introduce yourself?
Hi, I'm Denise Merdich. I'm a nurse practitioner. I work in plastic surgery and I do all the non surgical approaches in aesthetics. I also own and operate a teaching platform for injectables in the Tampa Bay area.
How long have you been doing aesthetics?
I hate to say years because it really ages me, but 24 years I've been in the industry and I've started off with Botox and evolved into fillers and all the other non surgical approaches.
So you've seen it quite a bit.
I've seen a lot of evolution in every single aspect of our aesthetics. It's exciting. The more that we learn, the more that we can do. It's just amazing some of the non surgical things that we can do.
I truly believe in the same. Spin your experience PDO in general.
I started my journey with threads about 12 years ago. I had threads from a plastic surgeon in France. We were in an office and he put like about 100 threads in my face. And the thread market wasn't really known at that time. And we didn't even bring threads to the United States yet.
Mhm.
So I had threads and I had every complication that one could have. It was great for us as an injector to experience those complications and know that they're self limiting. After I got over the humps of all the side effects, I discovered that 6 months later, I was loving my face. I was like, wow, this is amazing. One side of my face wasn't so good. So we had to take the threads out. 4 months later, I discovered my neck on one side looked amazing, the other side did not. One side of my face didn't look so good, the other side did. And I realized, wow, threads really work. I was doubtful in the first 4 months going through all these complications that this is not for me. And that particular time, that company gave me all the threads to use. And I had a whole kitchen full of threads. I was about ready to throw them in the garbage. I didn't. I put them aside and I thought, time will tell, right? And I'm very grateful that I did because I soon learned the power of threads. I figured out how to get this right and to overcome the complications. Once I did, my practice grew and grew.
When I got thrown into the industry, I didn't know anything about polydioxinin. I started in nuclear medicine, which is a completely different field altogether. The more I started learning about it, because I'm a molecular scientist, so when I started going into the science and into it, I really did discover the power of PDO. And a lot of people, when I got into the industry, they either are completely afraid of the product or they just don't know that it's been used for forever and
Right.
all the modalities. You're using it in OBGYN for cesarean section, cardiac surgery for wound closure. I came into the field and had to read all these white papers, working with plastic surgeons, working with nurses, and just getting all this information. It's quite overwhelming. At one point, you just want to put it aside and think about anything else that's easier or just let me just think about Botox or filler. But PDO is
Well, in plastic surgery, I've been around long enough to realize that we've been using PDO structure and suture material for a very long time, and it's safe. They've developed other procedures around that composition. So they are taking the materials that we are using for suture and making forms of implants and forms of things that are inside the body that are staying. We know because it's a safe material. What we're doing with this building collagen is just a little element of that.
yeah.
And any suture material, I tell people that any suture material outside the dermis, laying on the outside of the skin, is not going to be well. And so our epidermis doesn't like that. So placement of threads is very important.
What is your experience with working with the different materials since they have the filler threads and PCL threads, PLLA threads? What's your experience with the different materials?
PDO is still my workhorse of lifting, and I always go to that for lifting of skin. I also use PCL, and PCL works great for different areas that I may want to don't want to see the thread. And then I will lift with the PCL. When it comes to collagen building, I use a combination of all three threads, all three different types, which is PCL, PLLA, and PDO. I combined those materials and I have not had any problem with combining those materials, creating hashtags in skin, and that will actually build collagen for a longer time. And patient selection, depending on w- what the problem is. And if it's crepey skin, if it's thin skin, whatever, I may be choosy upon which material I'm going to choose. But I'm not afraid of any one of those materials. And I've used them in combination with huge success. Um, I am very diligent about taking before and after photos. Plastic surgery has taught me that you really have to take your good before and after pictures, make sure that it's the same lighting and all this sort of stuff. We take pictures every 4 months with people that have threats. That is a protocol. If I discover that somebody is not building on PDO, then I'm going to switch to maybe some PCL and combine PCL with PLLA. Or I'm just going to try PLLA. Different people respond to different things, just like all of our other aesthetic modalities, like Botox. And we have 5 different Botoxes on the market. Maybe somebody will respond a little bit better to one versus another.
Yeah.
So maybe changing that path and doing a PLLA or a PCL may be a little bit better for the patient.
There like Botox and our metabolism working better with one over the other.
Mhm.
And it really jumps into safety. What do you think is a protocol? Because PLLA is very similar to the Sculptra product as a biostimulator, and then you have PCL, which is longer lasting but different altogether. What is your protocol for safety on those things?
When it comes to safety, placing a thread is not going to occlude something and it's not going to cause any sort of necrosis to the skin.
Mhm,
Okay. So right away, I decrease the sculptor because I use sculptor threads instead,
mhm,
right? So the safety for me that I don't have to worry about injecting 10 cc's of Sculptra into a patient to build collagen. Now I just create a hashtag that consists of 20 to 50 threads. I'm getting the collagen building. And that one treatment is staying for 2 years. So the safety of that allows me to sleep at night so that I don't block any blood vessels. I don't have to inject into a blood vessel. I don't have to worry about any necrosis. I
mhm.
don't have to worry about all of the other scary things that dermal fillers could actually happen. Even if you're aspirating using a cannula, all that sort of stuff comes into play when we're injecting a face, whether it's a dermal filler, whether it's a thread. So the safety for the thread factor, just talking about threads in general, we want to make sure that they're in the right place of the dermis.
Mhm.
We're building collagen in the mid to bottom of the dermis. So all the reticular spaces and all the fibroblasts are in that area. So if we're wanting to trigger collagen building, we need to get it in that proper plane. If we go too superficial, the skin is not going to like it. And then the skin is going to cause some side effects. To avoid those side effects, depth is very important. Side effects that you're going to get from Sculptra or a Sculptra thread is going to be the same. The epidermis is not going to like it. When it comes to safety, I think the overall is the occlusion of compared to dermal fillers, the occlusion, you have no occlusion with a Sculptra thread. I place Sculptra threads underneath eyes, above lips, around the lips, in those areas where I cannot place Sculptra. Forehead, right?
Mm,
So those are the areas that have a more positive outcome and no risk profile. That is a go-to and Sculptra threads in my eyes are going to build a little bit more volume and it gives you a little more modality than just putting a PDO thread. If somebody needs extra collagen building, they need something more than the PDO that will dissolve in 4 to 6 months. We
yeah.
want it to dissolve over a year period. And then we want it to build collagen for up to a 2 year period. So that's going to be the benefit of that
Mhm.
and take the risk out of it.
Yeah. I agree. This is one of the reasons why I did choose this company, and I'm not sure if that's one of the reasons what brought you over here too, because
Well, the
uh,
variety of threads that Lays on Grace has is you're a kid in the candy store. And so I find it exciting that, oh my gosh, I can choose such that variety. And Lays on Craze was the first company to come out with the blunt threads around the lips, blunt threads around the eyes. This was like evolution to the finest because when threads came out, we were putting or sharp threads underneath the eyes. So
yeah.
people were getting bruised for weeks, right? We couldn't help it because it's a sharp needle. Developing the blunt threads has just been amazing. So now somebody can get those little lip lines fixed without any bruising. So that was just so good that evolved that way.
I remember when I first started and I started teaching and I had to teach the representatives and then I started teaching nurses and doctors on the placement of the sharp needles, and I'm telling them that they have to be extremely careful in vascular areas because you could go too deep, you could go too superficial. It was definitely something that had a nuance to using. At the time, I think a lot of people were having bruises, and I can contribute that to a lot of the scare of using threads, but we have cannulas now. We have the more blunt cannulas, the sharp ones.
Laser Craze was on the forefront of developing all those threats. Other companies will follow suit, but it's interesting that Liaison Craze has had so many different varieties of threads, both sharp, both barb, and the other companies still don't have that.
Mhm.
So it's just amazing. And that's why I chose Liaison Craze. Through Astra Institute, we actually train. I wear many hats. And not only do I put in threads in patients every single week, but on the educational realm, I definitely need to make sure that practitioners that learn threads do not have side effects and so forth. If we had so many side effects and we teach, say, a class every other month, if we had so many side effects, that's all I would be dealing with is side effects. So safety and injecting correctly is utmost importance. And we teach you how to use these different threads and what are the best threads to actually use for what area. And so a lot of that will shine through in any training that you take.
What are some of the safety and protocol techniques that you use?
To get optimal results, patient selection is very important. Do they want smooth and twist threads? Do they need that in the beginning to build collagen? Then we'll go to a barb thread later to actually lift skin and pull. What does that patient need? What is that patient selection looking like? We, of course, as injectors, injecting in the proper depth, injecting so that we're not pulling skin too much to give a side effect that was going to last for 2, 3 months. We don't want that. We want all the threads to lay in the skin nice and smooth, give that lifting effect. For the most part, when it comes to safety, is making sure that the patient's comfortable, making sure that you're using lidocaine. I use lidocaine with epinephrine so that it blanches the blood vessels so that I can go in and do what I need to do safe and not placing the threads too deep. Because if you're placing the threads too deep, you're going to irritate the nervous system. So we don't want to actually have any sort of motor nerve system, or we don't want the threads to sit too superficial to have any sensory feeling. All of this is important when you're learning technique. We definitely focus on avoiding the nervous system and not placing too deep into the nerves or around vessels.
I know that you are one of the sought out trainers for Les Encres. Is this something that you spend time teaching?
Aside from me injecting and loving how to inject these, it gives me a different modality in my practice. It really offers a great outcome and happy patient, happy results. And it's fun for a practitioner to do. And when I'm training and on the educational platform, everybody can see the passion that I have for threads. Threads are just exciting. They're like, let's paint a picture and let's do it this way. The practitioner has their ability to paint that picture however they want that day. We focus on all the hands on and give you at least 3 to 4 patients to actually get your hands on to actually do the putting in the threads, putting them in the different fashion. There is protocols for this. It's not that I always know when somebody has watched YouTube and that's been their intro to threads because they just stick threads any old way and they're just sticking them everywhere and they're half stuck out of the skin and they're not even in the skin. And there's issues with that. So we don't need to use thousands to get the results, although Les Encres as a company would like that probably. But there is only so many threads that you can put in the skin before you end up starting to have problems. So there is a art in this and there is protocols in order to get results. We have a lot of white papers. Most of them was recent within the last a year or so that actually prove that putting threads in a certain fashion actually produces more collagen building. So we're starting to get more studies out there that actually are available through Les Encres to show you that, oh, this is why we do how we lay it down. This is the process of why we lift in a certain plane, why we're building collagen in this area and laying it down in a certain fashion.
I think one of the things and you brought up YouTube, our YouTube injectors, which I really got the experience with over the years. Ever since COVID happened, we had this new plethora of people on social media and YouTube videos that explain what you should and should not do, and these are yes and no's, and inject this way. I even see Botox, inject all these other special ways, and I'm like, "Oh, no." I have a lot of videos from people, but this is the era of these really easy procedures they contemplate as easy. But in the thread world, they view it very something like, I don't want to touch is super taboo. We have a lot of people that are influencers that say, just stay away from threads. They're the worst things on the planet. They're so scary and they don't work. What is your take on that?
One of my hardest things to do is both the patient and the educational platform is to on the patient end, patients do come in and when I recommend in a consult, they're getting younger and younger, but they come in and they want natural results. They want a natural product. They don't want to go to fillers yet. So threads are up for conversation, right? I do exosomes. I do it all, but I've got to put all these modalities in that's going to be appropriate for that patient.
Yeah.
So for the patient that wants natural results, talking to them about threads, I'll say threads is a great avenue for you to go right away. They're going to go, oh, not threads. Oh God, I seen that and it's so scary. And I'm like,
Yeah.
okay, what's scary for you? Right. So I'm answering their questions as they're coming at me. Oh, those things I heard they stick out of the skin and they cause problems. I heard that they have lumps and bumps. So whatever that is, I say, listen, whether it's Botox or fillers, anything on the market,
Yeah.
you are going to see some side effects because people try to learn it too quickly and they don't learn it in depth and they just go out and do it. That is where the problems lie. Do we have problems? Can we battle those problems? Yes. If you have a lump and a bump, we're going to just create a little star over the lump and a bump with a smooth thread and we're going to push it down because it's trying to poke out of the skin. So there's ways of battling a lot of it, but there is a lot of myths out there, negativity of, oh no, threads. I don't know why it's out there with negativity. Maybe it's there with everything. But because I do so many threads, I get a lot of consults and a lot of the consults are coming in for, oh, I don't like superficial lines. I don't want to go to filler yet. What are my options? I lay it out there and I tell people all the time, you can laser. We can combine the threads with any of these modalities. So I may laser somebody first.
Mm.
Uh, and 3 weeks later, I'll put in threads right underneath the lasering. I may wait 4 months. And if they're still not happy, I may put a little HA, artificial HA, a little light filler over it. So while we're waiting for the collagen building to happen, we may put all these modalities together to make it work. And again, all of them are safe modalities. It's just the matter of trying to make that patient happy at whatever point they are in the journey. And that journey may change. That's why we have to change as injectors Threads, I speak about threads and I say the word threads probably at least 50 times a day because all the consults are like, oh, she's going to talk about threads. My MAs probably hate it because I talk about threads a lot. Where some dermal fillers like underneath the eyes don't is not for everybody. That's an area that can be a hot mess sometimes. And I see a lot of hot mess on the streets. And some people just are not candidates for dermal fillers. The skin is too thin. I put under eye threads in there. That is my hottest treatment. And that is where it's like a multi level marketing. You change one person's under eye threads, they're going to tell 5 people about it. Those 5 people are going to come to you. They're all coming to me for under eye threads. That's the number one treatment. That is my favorite treatment. And to change that lower lid even before surgery, if somebody wants it, they're improving that skin. Their surgery outcome is going to become better in the end.
I think the contributing factor to all these people being afraid of this treatment and all these bad results, I believe it's actually coming from those YouTube learning clients or practitioners that just learned on YouTube and they just want to do something and then they make a terrible mistake. And a lot of people too, when they're getting into it is an art, it is a practice like Botox, like filler. You can make a mistake, but that doesn't mean all of a sudden Botox is terrible and it doesn't work. We all have to adjust and learn a different technique or way. Everybody's different, so our anatomy is different. I think we can make a mistake and try to learn how to do better. For the ones that do learn on YouTube where they think that they could just bypass training altogether and then they give the bad name. If you were a patient looking for threads, what would you look for?
So, right off the bat, our patients are really savvy now. I bring my iPad with me and I have a volume of before and after pictures because before and after pictures are very helpful to see. What does this look like at 4 months? What does this look like at a year? What does this look like at 2 years?
Mhm.
I have a patient that's out 8 years with under eye threads, 2 sets. She spent $1,600 and now had it settled for 8 years. This is a long term journey, sometimes with threats. People want to know, is this going to hurt? Is this going to be painful? No, all lidocaine so that nothing is going to be painful. The only pain you're going to feel is the lidocaine, not the thread. So they want to know that is comforting. They want to know that injector is confident about what she's done. And when I say that I've done it for 10 years and I've worked with all companies, I had problems with some other threads. I don't have problems with Les Encres. I have been using Les Encres now for, I want to say 6 years. For the last 6 years, I don't have to battle complications. So if I do have a complication, I know how to fix it for you. So there's several different things that actually even in the education and through Astra, I teach people, here's how to fix things. We're not going to slice open the skin and take the thread out. There is a way to fix everything and make it very comfortable for the patient. We don't want lumps and bumps. We don't want threads coming out of the skin. So therefore, I'm going to teach you how to not do those complications. And number one, number two, if we do get a complication, we're going to fix those relatively quickly. So that person doesn't have a negative behavior. Also, our testimonials on threads are very important. So people have had threads. Oh, was my experience. People need to read those. With that being said, with the reputation, they're seeing the before and after pictures. Usually by the end of the consult, people are like, sign me up. What do you have an appointment tomorrow? You've got to go through that process with them.
I've talked to quite a few practitioners. They tell me that it's quite difficult to get before and after photos and testimonials. How difficult do you find that in your practice?
In the beginning, they maybe are reluctant to share their face because somebody else would see it. By the end of the journey, once their face looks better, they're like, "Oh, by all means, share it. Use my picture." They're happy to do that.
Mhm.
So the taking the before and after pictures are important. When I do it, I don't make the patient come back specifically just for that before and after picture. I'm taking it when I'm doing something else to them. Usually when I'm doing their toxin every 3 to 4 months, I take a picture at that time. That way I get all pictures of every single patient through their journey.
Mhm. I've suggested For some practices, because a lot of practices have IM shots, they have B12, they have CoQ10, they have glutathione. I tell them, "Hey, it's $5 for a B12 shot for the cost of the practitioner," or less than that, it's like $2 for a shot. Just tell them, "Come by, we're gonna give you your shot, just a little boost of energy, and then you take your before and afters in 3 weeks." 3 weeks actually really shows a beautiful transformation that they get to see, and that's just within 3 weeks. It shows them that it's actually beneficial because we're with ourselves every single day. I also have used PDO, but just the liquid version. And even for myself, I didn't think there was going to be that big of a difference. And when I took that before and I took that after 3 weeks later, I was with myself every single day. I'm like, wow, I can't believe it's done what it's done. And with a lot of people, I've seen those 3-week images for a B12 shot that costs like nothing for us. They came back. They do the little before and after.
When you say, I want you back so that we can look at it to make sure that it's perfect for you.
Yes,
And
that's
you're customizing that treatment for them. So many people don't get before and after pictures on other things, even Botox, fillers, laser, whatever, facials. And that is very important. That's our CYA. And that shows us. It's also going to show us if a patient isn't responding, maybe you need to turn the page to do a PLLA or a PCL. And maybe you need to change the path of their journey. And we all want results. And I don't want a patient to go through a year and not have results. I explain that to the patient and they're like, oh, yeah, okay. And I'm like, you have to have patience. And they're like, I have patience. So they already know that they need to wait for that, right? When it comes to the barb lifting threads, I take a picture immediately because you can see that lifting and it may relax a little bit. And then they come back in a month and we take before and after pictures and we take them again at a 4 to 6 month period. We're seeing that lifting a little bit more instant gratification than some of the other stuff that we do. That's a very good tool and it makes the patient feel good that you're following up on them and you're concerned about, are they going to build collagen? Is this crease or crack or whatever we're fixing going to be fixed?
yeah. Do you feel like it also protects your practice from the clients who say, "Nothing happened, I spent all this money and there was no results." Do you think that it also protects you taking those before and after photos?
Yeah,
There's
absolutely.
definitely
And it also leads to that patient seeing that one without area, and then they want threads everywhere. Where else can I use it? I was focused on my neck. I think I need it in the neck. I want it for my crepiness on my arms and top of knees. It's just like a thread craze. So my thread users start with one area, and it would be interesting to do that study to see what happens to them along the way. They've all done at least 2 to 3 areas in a year because they start branching out to other areas.
yeah.
Can you do this? Can threads do that? That is something that sets me apart in my practice because nobody else is doing threads. People are coming to me just for threads. It's, oh, go to Denise. She's the thread gal, right?
Yeah.
They'll be like, the thread queen can answer that. I can't get by in my daily practice of non surgicals without the use of threads. It's such a wonderful asset for us in so many ways. And we haven't talked about ROI yet, and we will talk about that. But if I'm there and I'm doing something very helpful for that patient, it is rewarding, but I also want it to be rewarding in my pocketbook. I'm not standing there for free every day. So that is for another conversation, but it's a win. Threads are a win in so many different ways.
I like that you have so many different mixes of modalities that you teach. It's in your background too. So I love the fact that there's all of those things that you do teach and you
No,
privately.
we do have, if they're not getting collagen building, I'll enhance them with the drink, right? Collagen drinks. We need to do in 4 weeks a microneedling, and then we're going to put topical threads on it to help it.
Yeah.
So there's so many different things that we can put in the mix. These people are buying skincare off the street. They're buying procedures. We want to sell them procedures that work. When you talk about topical threads versus injectable threads, you're baking the cake with the injectable threads. you're putting the icing and the fertilizer with the topical threads.
Yeah.
So that's an easy procedure to do in 4 weeks. We're going to enhance this and give it the best outcome that we can. You may need more than just injecting threads underneath the skin and sitting back and waiting. So we're adding these other modalities in with it. If it's laser, I laser them first and then I put in threads. So we're allowing that dermis to build collagen at many different avenues.
I
And
I
that leads to great success.
I love that you brought up the topical threads. I'm obviously a huge fan of the topical threads. What have you got to see with before and afters, the results that people are getting because they're either too afraid of using the actual threads and they're just like, oh, I'll just microneedle. And then they fall in love with it. And you're like, hey, I can also do a facelift with that same material. Have you gotten to see that it's easier to sell it that way or just even in general results?
I think that for me, I've used it more of texture and surface to remodel. And the microneedling is adding some alone. And then you're putting the bonus of threads being smeared all over your face. You're not just doing one area. In my practice, we're doing a couple different areas and they need an overall rejuvenation. That's where the topical threads come into play. So I use it with laser, I use it with microneedling. Anytime that we can get that topical on is going to be better. I don't use just topical threads alone. I use it as a adjunct to other procedures. And then you want to rejuvenate that top layer of your skin. We need to do that with the threads.
Yeah.
So we need to help that weathered skin that's on the top while the cake is being baked with the actual threads.
Yeah.
And I've always used those analogies because I think it's relatable in your head that, oh, okay, we're baking that cake. Now we're putting the icing on it. And we're
Yeah.
just trying to help the topical realm of the skin.
I like that you think about it on a multi-layer.
That's to be
Yeah.
multi-layered. Yeah.
I do I've used it alone because I really haven't really needed to use much of anything else. But truly, I think it's a great innovation of PDO now in the industry. But I like that it's a new innovation. It's something that it's so different and I can't wait to see where threads go.
And again, you can use that as in a combination. If
Yeah.
you want to use it with PRP, use it with PRP.
Yeah.
Use it. Well, I think exosomes are better. So I'm going to use it with a PRP engineered product. And then I also use it with exosomes. So if I want, the list is ongoing of what you can do. And we have those clients that, hey, listen, I'm not coming in here and doing just microneedling. I need something better than that. We're not doing a foo-foo facial like a spa. A foo-foo facial relaxation facial is good for what we want it for, right?
Yeah.
But we want to see outcome results, long-term results. And that's where we're putting all this other stuff into play. And we may have to use the combination. It's very hard to say that you can do one modality and make it work. And I talk about under eye threads. I put them underneath the eyes and it fixes that underneath the eyes for sure. But
Yeah.
am I telling them that they still have to use an eye cream? So we're always layering things,
Yeah.
right? That's why we have hyaluronic acid in makeup, not put one procedure into just, oh, I'm just going to do that and sit back and wait. And everybody's skin is different. And where do they fall at that baseline? So they may want, you have to offer them all this array of stuff. Now, what do you want to do?
I like the thing that when I speak to some practitioners, they ask me if this is something that is so great, why didn't you just put glutathione and niacinamide and throw some growth factors? And because I truly believe that if it's PDO pure, it's just pure. If you wanted to use it all by itself, it gives you the opportunity of tailoring your treatment exactly for that particular client. They could be allergic to any amounts of things, especially
Yes.
since we have a countless amount of skin boosters with different ingredients, even just with creams on your face or sunblocks or different things we do topically. Some of those materials can irritate the skin. Some of the salicylic acid can irritate certain skins depending on how potent it is. So I think having it very pure and allowing the practitioner like yourself, who's I want something specific. I want exosomes with this growth factor, specifically with just PDO and it's going to be a very clean treatment that I know it's only these two particular things. Or I want it with PRP that I know it's very safe and there's absolutely no reason why that person should be having any reaction whatsoever. And that's a very sensitive client that I'm afraid could have anything reacting to them.
Yes. And you can stage all this, right?
Mm.
Some people want to start very natural, then progress. So educating them and laying out everything they've had. Now, our consults are more and more, they want to know what they can do over the next year. And they don't want to know, oh, okay, I'm just coming in and doing this procedure and that's they know they're ready and they're prepared that they want it all laid out. They want a plan for you to turn around their skin. So it's our job as providers to give them everything they could have. They may not be able to afford all that in two settings. It may take a year to do this. Putting threads intermittently into their plan over the next year is something that they appreciate and they're wanting. I've changed my whole consult platform compared to what I was doing years ago. And people love it. They're like, oh, okay, now I know I need $6,000 to get this whole plan done over the next year. And you know what? I'm going to be doing this in 4 weeks. And I'm going to be doing so they know the time frame, they know what you want it to do. It's very important.
I'm glad that we got to talk about the combination of treatments. I think it's by far the most important thing.
People ask me all the time, okay, when do I do laser? When do I do threads?
Mm.
When do I do microneedling after I do threads? Right. So we have it laid out that we say when we laser, as long as your skin is healed, usually within a month, we do threads. You don't want to laser over a thread because then you're going to melt it and make it go away. So that's important that you're going to put that laser first and then you do the threads. Right. In other sequences, when you do threads, you don't want to come back and microneedle 2 weeks later or a week later. You're going to move around that thread. That thread isn't had stand ground in the skin yet. So you need to let that rest and let the skin do its job first. And then you can come in and microneedle and add threads 4 weeks later. So there's a time frame for all of this that one may want to do. You're putting in barbed threads and you're lifting face and neck. You definitely don't want them to do a facial within that 4 week period because you don't want to move those threads. We don't want an electric toothbrush buzzing around all of these threads on the inside that you just put, right?
Yeah.
So there's certain things that we actually have to educate a little bit, but sequence of events is very important for for the injector so that you know what you can do and what you can't do.
What's your take on using Botox and threads, which are to me the best combination? But how do you go about that combination treatment?
I do a lot of threads, particularly in the forehead. I want my muscles to be relaxed when I have the threads in so that they don't move around the thread, whether it's a barbed thread or a small thread. So I usually am doing the Botox and then 2 weeks later I go in and I put the threads in. Or I'll start with the threads. 2 weeks later, I'll do the Botox. Now, the only reason that I do it that way is because I don't like to hurt a patient. I use a lot of lidocaine. I don't want to put the Botox right behind the lidocaine or else it's going to just spread everywhere.
Yeah.
And then I'm going to have some bad results with the Botox, right? So I always say any kind of toxin, I pose it 2 weeks before, 2 weeks after, and it has to be in the equation. So that way a thread is not moving around and is particularly around the mouth or in the jowl area or whatever. We want to use the toxin with that to control our environment when we're putting the threads in. So it's very important.
Yeah, I explain to a lot of practitioners too, because heat is the catalyst for PDO. Heat activates PDO. That's why when a lot of people are like, hey, can I go into hot yoga right after treatment? Well, unless you want the results to be short lived, it's going to break down that thread faster. Heat breaks down threads. When I explain about Botox, using Botox prior, which is the perfect protocol, 2 weeks before, it does freeze that muscle, creating less heat. Muscle contraction comes with heat, starts the catalyst, less heat, longer results. So you're just prolonging the results. I love the combination of Botox and PDO.
And they've invested in threads. So they want to make sure that they're not eating away that thread in whatever they're doing. And going into a sauna and working out right after is only going to heat up that skin and then you're going to get more bruising, right?
Yeah.
So if you want more bruising, go for it. But we're trying not to do that. That's why we recommend a little bit of ice on the area afterwards. Let
Yeah.
your skin rest. Let it do its job. Why ruin what you just paid for?
So, since we talked about combination treatments, we talked about a little bit of protocols when it came to Botox. Versatility. How versatile do you think PDO is?
For a lot of the consults, a lot of the patients that are coming in, I can use them for building collagen. I can use them for changing scars. So I work in plastic surgery, and we have some people that want to give it the best effort to make scarless procedures. Some people do make scars for whatever reason, and we're helping them out. I put threads underneath scars, and it changes that whole structure of scars. I've changed old scars, something that's been in a face for a good 20 years. And I put threads under there and have made the scar almost non-visible. It is amazing the versatility that you can do. Also, the versatile use of the thread. What I'm doing for the eyes, I may see that somebody has really crepey skin and I may have to use an eye thread, a small thread in that area because their skin is too thin and we may see a thread. So then I'm shifting. Now I'm doing it underneath the eyes. It's really, you have to think about gauges of the thread and where to put those in the skin. So the versatility of a 30 gauge thread can be used in so many places. The versatility of a 26 gauge thread can be used in so many different places. Something that I'm using for the upper lip, I may use for the neck and I may help necklace line. The versatility of that is just so open. And that's what creates the artist in us is, wow, where am I going to use this thread? And it's exciting. And you're like, I got a new use for a broom thread or a specialty thread. It's it's the excitement that creates for the injector, and then you have to think outside of the box. So many people get used to using the same filler for the same area, using this same toxin for this, right? So we've got to think now the thread world is now open to a lot of versatility. We can use different threads, different areas. We can mix them up. We can use them together. We can use them separate. We can put combinations in. So that makes it much more exciting and better outcomes as well.
Do you think with the rising cost of everything, the economy and all of that, out of a lot of different treatments that are skyrocketing in price, do you feel like it's still cost effective to add this treatment to a practice?
For the most part, when you're purchasing threads, they're not as expensive as some of the other modalities that we use. Toxin goes up every year, fillers go up every year, laser goes up every year. So those costs to buy those are sometimes more expensive than threads. My threads that I order for the ones that I order are cheaper than ordering dermal fillers. And I'm getting several patients out of them. So my ROI for that is huge. I think as when we talk about our threads, they're affordable to buy from the practitioner and for the patient to receive has become more affordable. And I think it's like anything else. When it first comes out, people didn't even know about threads 10 years ago. So the cost of the thread procedure was a little bit higher. We've gotten so many uses for them. So now it's just not, oh, we're doing a thread lift and that's all we're doing.
Mhm.
So we actually, as the procedures have evolved and the threads have evolved, the procedures have gotten more affordable for certain areas. So we charge so much for nasolabial fold, so much for marionette line. As patients experience it and get the win, as practitioners, we say, oh, let's do this area for a little discounted price. Our margin for threads is higher than anything in the aesthetic margin. We have the ability to move the price accordingly. But I think the more popular it's becoming, and other countries are blowing up with threads, all the other countries are talking about it. It's becoming more common in the aesthetic market. So now the cost is really more affordable for patients. If you're ready for a facelift, it's going to cost, depending on your location, anywhere between 20,000 and if you go to California, it's 100,000. Okay, I could do somewhat of a lifting procedure for a fraction of that. We are making it affordable for and opening that patient population. Whereas before it was such a closed little niche. Now it's opening up. We've got more companies coming out. We've got more patients wanting threads. That's more of a positive end. It's the battle of positive versus negative because we still have a lot of negative that we need to battle through, and social media that gets on there and just makes it a bad name. So you've got to see through some of that. But as practitioners, we want to keep positive thoughts. We want to keep it affordable for the patients. I'm in the Tampa Bay area. We've got threads everywhere here. It's very common, somewhat like Miami. We've got people that are really high class. You're going to get a thread lift for $10,000. And then in other areas, it's more affordable. I want you to have results. Clientele that have spent $6,000 on nothing but threads, $10,000, nothing on aside, just threads alone. So the market is out there and we just have to battle like we do any other. We've got bad Botox, bad fillers, bad threads. The more important thing is going to a trained individual that knows what they're doing, has a reputation. You can see that on social media. When you look at my social media, which is Faces by Denise, you're going to see 3/4 of my social media is threads. And you're going to see the before and after picture.
I like that. And you said you work with plastic surgeons. Do you feel like threads actually make it harder for you to do a facelift later, or are we helping? Because that's one of the hot topics on social media that is giving that negative light. What's your take on working with plastic surgeons?
I've worked with plastic surgeons for 24 years and they love it because they get a lot of consults and patients just aren't ready for a facelift. They go through the process and they think that they're ready and the neck is throwing them overboard and they're like really want it, but they're just not there yet. They have another 3 years, another 5 years. My plastic surgeon will walk that patient over to me and say, "This is Denise. She does the non surgical lifting and she can lift your face until you're ready for a facelift." So there's a market for that. There's also a market for people that have had a facelift and then it's relaxed a little bit for whatever reason. And over the years, 5 years later, so you could put a couple threads in and lift them back to where they were when they had a facelift. There is definitely a market for non-surgical lifting. Is it a facelift? No. And I tell people all day long, if you look at some of my before and after pictures, they look pretty darn good, like they could be a facelift. But you actually will see that lifting is significant. And if they're not ready for a facelift yet, this is going to be a better price and we can get you lifted for about a year and a half to 2 years. Most people that I do, because the thread quality is so good that we get lifting for about 2 years. So I don't have to worry about the lifting outside of that. Yes, they may want other areas in those 2 years. I'm not worried about putting my patient, the procedures out 2 years and I'm never going to see them. No, they're moving on because they like what they see. So they're going to do more. But there's always going to be a place with plastic surgeons. Through Astor Institute, we teach facial plastic surgeons. Lifting has evolved. Years ago, we used to have contour threads and they were terrible. So every plastic surgeon hears the word threads and they're like, "Yikes, we don't want to do that. I took more threads out than we put in." For the most part, if they're put in right, you don't have to take them out. These are all dissolvable, they're reabsorbable. So if you get a thread that is even not right and you can't do anything about it, it's going to absorb. We could laser over it and it'll go away faster. So there's things that we can do. Patients love that interim in a plastic surgery world. They're not quite ready. I like the idea that I can go get a lifting effect and on the face of the neck and put me out another year and a half. So there's definitely a market for that. The plastic surgeons that I work for endorse the use of threads. It's not taking money out of their pocket. It's helping them to give that niche market that isn't really ready for the facelift yet or the neck lift.
You hit right on the mark here. Do you feel that they are at least not starting from square one when they before they got threads? They're starting from a new point.
And they've built a better quality skin. So when you do lift that, I was a case where I used threads up until the day that I was like, okay, listen, I'm going to need a facelift. And
Mhm.
so I told my surgeon, like, I went in for something else and I said, you know what? The facelift is more important right now. I have over 250 threads in my face. And he was like, so that's fine.
Yeah.
And it ended up being that during the facelift, he didn't hit one thread at all, not one. And I had them everywhere from lifting to sitting in my skin in the dermis. They're pulling it at different levels. I joked with him saying, you're going to run into all these threads and you're going to have to take them out. He's, I'm not going to take them out. I'm going to leave them in because this is going to help the healing phase. I ended up with 2 bruises, one on my face, one on my neck. My healing was second to none. I was back to work in 5 days. I was looking a little pulled, but my healing was over the top. He was like, I don't know what you did in this healing phase. And I'm like, think about it. I had 250 threads all throughout my whole face. Before you started, at least 2 months before, 3 months before he started. It's amazing. Our healing, what we see is the healing phase, which you should, because we're helping the dermis. So in that reticular dermis, you have threads maybe a little deeper in the deeper planes when we're lifting, but they're all building collagen. So that's only going to help you in the healing phase.
You talked about getting a facelift and having better results. Do you feel going into the cost of it and the return on investment, what that looks like? Because you've gotten so many threads, what that looks like for a patient?
Let me give you some examples. If I do a marionette line, I'm going to be using about 12 threads, right? The cost of that thread is $6 a thread. My cost is $72 for that area, right?
Mhm.
And then I'm charging 750, 850 for that area. So that's just one example. Underneath the eyes, I do everybody in the Tampa Bay area, hottest area, right?
Mhm.
Marionette line takes me 15 minutes. Underneath the eyes takes me 20. I'm putting approximately 12 threads per eye, and my cost is $144. I'm charging the patient $850 in a 20-minute session. So the return on investment for threads, when filler is down, when the market is down, people are like downscaling their procedures. This is a procedure where I may not have much filler this week in my schedule, but I definitely made money on threads,
Yeah.
right? So the money, the return of investment on threads has kept me in the market and kept me making more money than an average injector because my return on investment is so huge. When we put a syringe of filler in, it's 400 approximately, depending on what filler it is. If I'm doing Sculptra, it's $457 per vial, and I'm going to do 2 vials. And it's also going to take me a good half an hour, 45 minutes to do all that product.
Mhm.
So that return on investment for me is just not there. It's my time is valuable as an injector as much as it is our overhead. But for threads, it's a win because it's easy, it's fun, it's quick. I can put an area of smooth and twist threads in a matter of 15 minutes. We give them a little lidocaine, put it in there, and you're done. People are like, wow, this is done already. They were anticipating such a drawn out, long process, and it's very quick. For an injector, it means that I can make that money in a day and put on so many procedures. That's going to take my loss in many other areas. Now you can bring it up and get rewarded with threads. When you're doing threads, you don't want to rush and you want to make sure that you're getting them in there correctly. But for a new injector, it's going to take them maybe half an hour to do one area. That's putting the lidocaine in and then doing the act of the thread. The act of placing the threads, when you know what you're doing, even for a new injector, knows where he or she is going in the skin, that still doesn't take very long. The smooth and twist threads are really easy. The more difficult barbed ones take practice. And that practice is going to yield good results because the more practice you have, the better outcomes you're going to get. For the most part, that takes a little bit more skill than placing the smooth and twist threads. Through Astra Institute, I have courses where I start you out and we do just the smooth and the twist threads. And we get the benefits of that. We show all the benefits. We show how easy it is to place those smooth and the twist, what combination to use. So you get that skill level down. Then we start learning how to do the barbs. Then
And you
we
can
do
make
the
your money.
lifting,
Yeah.
and it's become successful, right? If you're looking at your portfolio of threads, as an injector, I'm going to be overwhelmed. Oh my gosh, where do I begin? What do I order? How do I do this? The company is good at putting them in packages for beginners. This is what you want to order, but you have to crawl before you can take off running. And so you've got to just practice and do them proficiently and take your time. So it is going to be slower in the beginning, but you get faster the more that you do them. And the ROI is always going to, as a new injector, be smaller. But you know that when you keep practicing, you're going to get quicker and your rewards are going to pay off a lot more.
Side effects, some challenges with side effects that you've gotten to deal with, and how do you handle those challenges?
When a patient calls stating that they have rippling or they have a bump or they have something or they have hurt, right? First of all, I want to see them because I want to see what's happening with that thread. You can get a lot of visual. Yes, you can have them send a picture, but I have them come in so that I can see the problem. If it is a bump or a lump, I can strap it down. Mono threads in there at a star level or a hashtag over a bump, and I can push that down because the bump is the actual thread coming up through the skin. So if I can level that out and push that down, that'll be fine. That takes about a week. So that I just reassure the patient it will go away. Most people are okay with the side effects. Knowing that you can do something about it as a practitioner, they feel much better with it. If it's a kink in the thread, you may have to make a nick and pull it because maybe you placed it too superficial or too deep. So there's ways if you can just nick the skin with an 18 gauge needle and get in there and handle it. Worst case scenario is that we have to take a thread out. And you know what? We can do that very easily. We have skills and you take it out and then you place another one at another time. Mostly it's maybe lumps and bumps that are going to occur because as movement happens with skin, those threads are going to move as well. So that's why I say facial rest after you have threads, because you don't want to keep moving that thread around until it's set in the skin. So all these little things I develop, I have a technique where I use a cannula. So if a thread's sticking up or it's wavy, I push it down with a cannula so that we can get it to lay down a little flatter. So
Okay.
there's always things that you can do with this. It's laying right underneath the skin. It's not like anything major that's going to do harm. So there's not any long-term major side effects. It's only the short term of, hey, we need to conceal this little lump and bump or this waviness. And you can most likely use your small threads to actually do that. And that's what we teach in our courses, not only how to place them, but we need to teach what are we going to do if we have a side effect? And this is how we're going to fix it.
Yeah.
I think when, as injectors, you want to go into doing threads, patient selection should be key. If you know that patient is a picker, I'm going to be very cautious about doing threads, or I'm going to do the PDO threads that will dissolve in the skin faster. I'm not going to use a PLLA or PCL. If you have high mobility in a mouth area, then I'm going to use maybe a smaller thread, not a bigger thread. So your patient selection has to be good before you actually engage into the procedure. So you're not having the side effects afterwards. If you know a patient is going to go out and play pickleball an hour later, she's going to be potentially exercising. She's going to bleed. She's going to bruise.
Yeah.
Bleeding, bruising, swelling moves threads. Activity moves threads. Nothing with your mouth wide open. So we go into all these things post treatment with patients before they leave. I also give a little drop of steroid, and that helps some of the swelling go down a little bit faster on a lifting patient. But for the most part, talking them through with that and educating them that facial rest is very important. And this is why it's important. Because when they come back for those side effects, what do I have to do? Now I've got to see where that thread is. Did it move? And people get crazy about, yeah, I'm going to move my face. You know what? That's fine. And the thread's going to move too. Who cares? It's still going to build collagen. It's still going to pull. You didn't ruin the thread by yawning. It is laying underneath the skin. It is going to have a little bit of movement and it's okay. It's not detrimental. It didn't break. It didn't move.
Yeah.
I had the privilege of going through the first 10 years of my career of doing it. The first 5 was threads were breaking all the time. We would put them in a cheek and they'd end up down by the neck. We
Yeah.
would end up putting them in the cheek and it'd come out the nose. This is craziness.
Yeah.
So that's the importance of picking a good company when you're laying down the threads. You want to make your choices wisely so that you don't have those side effects in the end, but they can all be taken care of.
You've experienced quite a few threads. One of the things that you and I got to meet on is multiple different companies that I worked with. You tried them all from my experience. You tried them. You are not one to not physically try a thread or see how those threads, and you talked about threads breaking, which is where I advocate for thickness of thread snap. What's your experience with trying all these different companies? And I'm sure that's what brought you to Les Encres at the end, but what's your experience with using them?
I think that actually drove my passion even more because I knew that it wasn't my technique. And I knew that I could put it in and wow, how could this happen? So I soon realized that's why I went and actually looked at the companies and how it's manufactured because the way that it's laser cut and the way that those threads are cut and the position of those barbs mean everything.
Yeah.
How many barbs do you have on it? What are they positioned? How deep is that cut? Is that cut not going to be deep enough to where it's going to grab onto skin? That's the whole purpose of us doing the procedure is to grab onto that skin and be able to pull up. So that was very important. And the companies that I did, some of them were crumbling before I could get them in the face. I know that I took care of that thread. I know that I did everything I could possibly do, as in the proper storage and so forth. We discovered over the years, they were just coming out of normal packets to begin with. And now we've evolved as to the packaging actually enhances the longevity of the thread. The threads were all over the board. And it mainly was the laser cuts were big enough to actually create the actual pull. And that pull was happening in the beginning. And then all of a sudden they would be sliding around everywhere. And so we soon discovered that just having the barbs on one side, maybe we should have them on both sides. And then it evolved to, oh, now we're going to go around 360. We're going to put the barbs 360. This whole industry has evolved over time. What I was doing to my first 100 patients, I'm just so glad that they stuck with me. And now the threads are much better because they remember. They laugh about it now. It wasn't too funny in the very beginning, but that's what we had to deal with. We
Yeah.
only had one company for the longest time,
Yeah.
and I taught with them, teaching all injectors with this in the very beginning. In the beginning, it was such a hot thing that everybody wanted to learn. Then we didn't have the good threads that made us look good. And we could do all the skills right, but the thread wasn't correct.
Yeah.
So thank goodness that the research and the development and the process that Les Encres has been over the last years has just evolved into the best quality threads that one could get. I
Yeah.
use these threads. They are the best on the market and they make me look good. It's my skill, then the good thread, and voila, we have a good outcome.
You're an educator, you're a private trainer. What do you offer as a private trainer?
I look to see what you want to learn. What is your goal? And we will take it according to that. The training is customized according to your skill level and to what you want to do. Some people want to dive in, they're like, I want to do everything. I'm like, listen, we have to take it little and baby steps. I've even evolved. When I first started teaching for threads, I had one course and we did everything in one course. I was exhausted in the end. People were so overwhelmed. I think there was still a fear factor, right? The goal is for you to come out not to have that fear factor, to be, wow, maybe you went into it with some fear, but you're coming out of it like, I've just done 4 patients and seen the difficulty of how to place a long thread versus a short thread and overcome how to do that. I teach you techniques on how to place them so that you're not hills and valleys in the skin and it's
Yeah.
nice and smooth, right? That prevents side effects. So everything that we go into that teaching is to prevent side effects. The goal is to get you very comfortable, whatever level you're at. We keep the courses very small, and some are private trainings because people want that one-on-one. I want to do 5 patients all day today with you. And I want to learn all different tidbits that has to do with threads. And some of them are a small group with no more than 5. And then you just keep changing and you're injecting all 5 patients. You're placing maybe 3 or 4 threads and then letting somebody else do it. So your goal that day, whatever that is, if it's a private training or group training, we want you to be totally comfortable with it. An hour and a half to 2 hours of didactic. And we're going to go through how to place these threads the proper way and maybe in what combination. Give a little bit of background, and then we're going to go in and do 4 or 5 patients. And that doing makes sense.
Yeah.
Everybody has told me that's come to the course that's taken other courses. Oh, yeah, I took a thread course. Yeah, I learned about it. And then I went in and placed 2 threads. And I'm like, what? You placing 2 threads is not going to, I'm sure that didn't make you comfortable. And they're like, I don't even know what I
No.
was doing.
Yeah,
I don't even know if it was in the proper plane.
I've heard that
So
so many times. I only put 2 threads.
And
Yeah.
we have expert injectors over you so that we're working right there. So when you're putting that thread in, we're giving you tips along the way. And before you know it, by the end of the day, you know what you're doing. You can place an order and you can actually specify, oh, you know what? I like this thread. I like that thread. And I definitely want to order these threads.
Yeah.
So they know by the end of the training in that 8-hour period, what threads are used for what areas and what threads I'm going to use. And we try to offer as much variety in the training so that you get to see a little of each thread and what areas that would benefit. So I think that comfort level of having that hands on is everything. And when you're done, you're fine. We focus it as in we're doing smooth and twist threads in the beginning. You know what? We only have 50 different threads to use now. So
Yeah.
we simplify it for you.
And I think to conclude, what is your ultimate advice for everybody?
Don't be afraid. Don't listen to that negative connotation. Don't be afraid, dig in and do. When you start doing it and adding it to your practice, you're going to get more comfortable and more comfortable talking about it. You're going to get more comfortable showing your before and after pictures. But you can't sit around and think about it and go, okay, yeah, I'm going to do this. It's the highest profit margin of any aesthetic company. So you want to get there, but you can't sit there and think about all those things. You got to get your hands on, you got to do it, you got to be comfortable and don't be afraid. And know that there's little side effects. Most practitioners have trained in so many areas. They're putting in art lines. They have a great skill level in so many ways. And these are only going in the dermis, for God's sake. It's the easiest thing to do. We just have to put it in there correctly. This is easy. The takeaway is just get in there and dig in and do it.
Thank you so much, Denise, for your time and for your expertise and all your advice. I appreciate talking to you, and I hopefully
Thank
I'll
you.
see you soon.
Thank you. I love threads and I can talk all day about threads.
Thank you.
All right.
Bye. Thank
Have a
you.
good day.
You too.